Cbc Radio 1. Well, the charity Holway House has lost its funding for a program that serves at-risk seniors. Now, it was part of a pilot project that was funded by BC Housing. And to tell us more about the funding cut, we are joined by the president of Holway House. Jenny Konkin joins us in studio this morning. Good morning to you.
Good morning.
Thank you for being here, especially at this early hour. We appreciate it. The program that had its funding cut was called Seniors Enhanced Independent Living Program. Tell me more about that program. What was it? What was the goal of that program?
Yeah, so we've been working with BC Housing in partnership to provide a service where we partner with nonprofit landlords to support seniors to age well in place. Mm-hmm. So we do one-on-one tenant support service, meaning medical coordination, advocating for home support services, ensuring that they have the care that they need, and then social programming, of course, to keep them active and engaged, prevent isolation and loneliness. And this program really, we saw huge success in a really cost-effective way where we're able to be on site. So as needed, seniors are able to access the service versus waiting for a crisis. And the partnership with BC Housing has been so strong. They've invested so much into seniors, really saw the effectiveness. And so this came as quite a shock.
And how many seniors were being helped by this program?
We've been supporting 400 seniors across 4 buildings in the Lower Mainland.
Okay, so that's substantial. Yeah. Now you had one senior in the program who needed a double lung transplant. Tell me about what you were able to do for him.
Yeah, so for example, when he goes in for surgery, he doesn't have any family here. And in order to be discharged from this life-saving surgery, his home needs to be clean so that it's safe so he can recover. Right. So we were able to get in there, make sure his home was clean, that he would be able to be discharged from the hospital, helped him with his discharge plan, got him home, made sure he had groceries and all the essentials so that he could recover. And he's doing great. He's working, has recovered incredibly, and we're proud to be able to do that kind of work.
And is that a typical story? Maybe not a double lung transplant, but seniors who are coming out of perhaps some medical distress or medical procedures who need that extra help?
Absolutely, and time after time we hear from doctors and nurses how helpful the service is, because often they're not able to discharge if there's not any support at home.
Right.
So this actually helps seniors spend less time in the hospital, saves on the healthcare system, and we know, of course, we want to be at home as soon as we can, as soon as it's safe. We just need that support in place.
We reached out to BC Housing and the Ministry of Housing about the funding cut. We got a statement from Minister of Housing Ravi Kahlon, and this is part of what it said. It says the Holway House program was a pilot project funded by BC Housing to augment the services they already provide. Now that statement includes some background information from BC Housing that says the funding was given with the understanding that this was a one-time funding. How do you respond to that?
It's interesting. We've been working together on this for over 3 years, and the purpose was really to get the research so we could have evidence-based data to present to the ministry so this could be put across the province as a model that we can use. Year over year, they've renewed the funding because the data wasn't finished and the project is working. And so we had no indication that this was going to end. And of course, with 11 days notice, I'm not sure what to do with that. We can't abandon them. We can't jump ship. And we meet often and regularly because we work together. We're partners. We work so closely together on this. So it did come as a shock. In terms of one-time funding, it was year over year, as in it's a pilot project. Yeah. And so until the research was finished, we were under the understanding that we continue our partnership.
Is this asking BC Housing to do too much beyond its core mandate of providing housing? I mean, it's not necessarily a social service organization, or it's not part of the healthcare system.
Right, and that's a great question, because what we look at is how do we prevent homelessness? What is the most cost-effective way to keep people housed? And so we're working with seniors who are housed and are on the verge of homelessness. Seniors are the fastest rising demographic in the homeless population. We need to look at that. We need to actually be on the prevention side of that. And so when we look at things like supportive housing, for example, the support service is what we see when we invest in that. That's what keeps people housed. So this is housing. This is how do we keep people housed, ensure that they're safe, and we're not seeing that number increase. A quarter of the homeless population are seniors. That's shocking. We shouldn't feel okay with that. And so I think where BC Housing saw the investment opportunity, or the way that this fits under BC Housing, is this is housing. We want to keep people housed, and we want to ensure that we're not seeing those numbers climb.
And what is the reality of rental housing for seniors right now? Because we see so many, smaller, older older buildings are being raised for, towers or bigger buildings. If a senior is tossed out of their home in this housing market, how difficult is it for them?
Well, when you look at a senior who's living on a pension, on average, they're living on under $22,000 per year. So they need to be in subsidized housing. The wait lists are incredibly long. BC Housing is constantly working to increase that stock. And when I look at the partners that we work with in nonprofit, their wait lists could be years long. I think the Seniors Advocate put out a report that it was 8% of seniors on the wait list received housing last year.
Wow,
Yeah.
Those numbers are not good. And with the funding cut then to the seniors, this enhanced independent living program, what happens now?
To be honest, I don't know. We're seeking support. I'm asking for the Premier to intervene. He actually helped us get this pilot project off the ground. I know that they care about seniors. That's not the question.
Yeah.
But are we realizing what this means on the ground when we make these budget cuts? Seniors shouldn't be the ones who suffer. We're asking for support from the community. We've had other donors step in before to bridge that gap where government can't cover. I'm asking to meet with the government and really, how can we look at this? This is a cost-effective way to prevent homelessness. I'm not going to give up on them.
When you hear the minister say that, well, this was a pilot program anyway, this was one-time funding for a pilot program, and there has never been any indication that they were prepared to continue it?
Never. In fact, I meet with them regularly. I meet with their research team regularly. This is a program that the whole purpose of it is so that we have the data to create a long-term funding stream for this program.
But when you show them the benefits of this program, what do they say?
There's never been a funding stream to support seniors to stay housed. And so their goal with the pilot project was to say, let's grab the evidence, let's get the data so we can take this to the ministry and create a long-term funding stream. Then they have it in front of them.
And they have that now. And why are they not responding?
The report won't be finished until July, so their team is working hard on it. And we just hit the fiscal year.
Right.
It falls at a bad time. And I understand the pressures on them. This is a difficult time.
Any chance at all of any interim funding to get you from the end of fiscal through to July when you can produce the evidence?
That's what we're asking for.
Yeah.
Let's finish the project. Let's finish the project.
Jenny, great to hear you this morning. It sounds like a very worthwhile program. Thank you.
Thank you so much for having me.
Really appreciate it. Jenny Konkin, President and co-founder of Wholeway House. It's 12 minutes before 7 o'clock on the early edition. Amy is back with your traffic and weather.
Yeah, they're doing some work on the 80th